am here to demonstrate a manual blood pressure today. This is my note cards, and if you will scan the audience, please. Okay, according to the American Heart Association, 1 out of 3 Americans has hypertension. 1 out of every 5 of those have some form of cardiovascular disease and don't even know it. And that is why it's called the silent killer. So 1 out of every 3 has some form of cardiovascular disease, and 88% of those can be prevented by just checking your blood pressure to go to the doctor. Now, manual blood pressures are more accurate than an actual machine. The human ear can hear the actual beating of the heart instead of a machine that may pick up other noises that can't differentiate those spots. So, now I'm going to show you the supplies needed for a manual blood pressure. You need a stethoscope. This part for the ears. This is the diaphragm that actually listens to the beats. And then we have a blood pressure cuff, also known as a sphygmomanometer. As you can see, we have the name on the board. Now, you actually have the cuff. Then we have the tubing that goes for the pressure gauge, which actually you will see as you count the blood pressure. This is the tube for the blood pressure, or the pressure bulb with a pressure valve. On the cuffs, there are different kinds of cuffs, and you would evaluate your patient's arm. They're small, medium, extra large. Knowing the size that you need assures the accuracy of the blood pressure. If the blood pressure cuff is too small, the blood pressure is going to read abnormally high, and if the cuff is too big, it's going to show your patient has a lower blood pressure than it actually is. So, if I could please have one of my fellow students to volunteer for me. Come have a seat. Okay. So as my patient sits, I want her to sit down, feet on the floor, not the legs not crossed, arms relaxed. Tensing up the arms constricts the blood vessels, which will also increase the blood pressure, as well as. Next, I want to find my landmarks for my pressures. I need to find the radial pulse, which is right inside the wrist. Use your fingers, because you cannot use your thumb because it has its own pulse. And then you also want to locate your brachial pulse, which is actually going to be the one that you use a stethoscope to listen to the blood pressure. Next, I'm going to apply the blood pressure cuff on her arm. Most of them do have where the artery goes to line it up where you'll listen to the brachial artery, but other times you would want to line it, the tubing, up with the artery itself. So this one you actually hook on, and I'm going to tighten the bulb to pump up. What I want to do is you locate your radial pulse, and locate the radial pulse, and you pump it up until you can no longer feel the pulse. And when you stop, you will note a number on the dial, and then you're going to add 30 points to that. And that just ensures that you pump it up high enough to get the accurate reading. So I'm going to put the stethoscope on, put the stethoscope on the brachial pulse site that you found earlier. I am going to close the valve to pump it back up. And it stopped at 110, so I'm going to go above that to 140. So I have 112/70. The 112 is called your systolic number, which is the top number. And the bottom number, the 70, is the diastolic. And with that, that is showing the force of the heart muscles on how hard it is pushing out into the body. So whenever your doctor says that your blood pressure is 120/80, you will actually know where that blood pressure comes from. So with lots of practice, you can perform a manual blood pressure yourself and can also impress your family and friends too. Thank you, and pan the audience.